Hi everyone, and welcome back. If you're new here with us, the Faculty of Pharmacy conducts a monthly webinar where we discuss the ins and goings of the world of academia and sometimes about the pharmacy profession. Today we have a special guest with us. He is a very busy man, but he has decided to join us today. I would like to invite Dr. Sohail, the Deputy Dean of the Faculty of Pharmacy, in discussing the vital roles that pharmacists play in global health. Please give him a warm welcome.
All right, thank you very much, Mr. Danish, for the kind introduction. Hi, everyone. I welcome you all in my today's webinar titled Role of Pharmacists in Transforming Global Health. Emergence of various global health problems has widened the pharmacist job scope. Today, pharmacist is a key pillar of healthcare system architecture. In today's webinar, I'm going to discuss various contents starting with challenges of global health. These challenges can be categorized into three major types: patient related challenges, disease related challenges, and medication related challenges. And based on the nature of these challenges, we will see how pharmacists can contribute to address these challenges. So the next one is reasons of changes in pharmacist role. These reasons are triggered by technical advancements and new healthcare modality. Then we will see traditional versus emerging roles of pharmacists that is linked with current models of healthcare. The term traditional and emerging carries subjective meaning depending on which country you are talking about. For certain countries, traditional roles are still considered as emerging roles. For example, the developing countries where they are not putting so much emphasis on the patient care process, and they still relying more on the product oriented care by the pharmacist. The next will be patient care process, pharmaceutical care process, evolution of roles of pharmacists, and lastly, the most important section that I'm going to discuss with you, the lesson learned from the evolution of pharmacy services in Malaysia. It's a very good case study, and then we will see how in Malaysia the pharmacy services have been evolved. So starting first with global health. Global health, in essence, put priority on improving health and achieving equity in health for all people worldwide. There is ever increasing burden of both communicable and non-communicable diseases globally, and particularly in the developing countries. So we will see how the pharmacists can contribute to address these challenges. But before that, let me list down few of the common challenges we are facing as a global citizen. First one, newly emerging diseases. As we all have witnessed in previous 2 3 years, every life has been affected at individual level, at community level, at global level as well because of COVID-19 pandemic. And as a result of it, the life before COVID-19 and after COVID-19 at different levels is not remained same. Other examples of emerging diseases are severe acute respiratory syndrome, Middle East respiratory syndrome, and then there is another term that is compounding this problem further: re-emerging diseases. For instance, Zika virus disease, Japanese encephalitis, and yellow fever. So on the second number, we have resistance to the existing drugs. Whenever the term resistance comes, we relate it antimicrobial resistance more than the other drugs. Although the resistance is a sort of natural phenomena, but the misuse of antimicrobial accelerate this process. And then with the passage of time, we are left with lesser options of effective medications for some of major infections, for example, tuberculosis and pneumonia. Following this is suboptimal use of prescription medicines. We all know overuse, misuse, erratic use, and contraindicated use of prescription medicine can cause a serious burden on our overly stretched healthcare system. Then medication errors and adverse drug reactions. Non-compliance is also a major contributor to healthcare burden. The reasons of non-compliance may vary. For instance, it may be patient related. For example, if patients forgetfulness, and then patients inability to take the medicine. It may be disease related, where the patient is bedridden, or patient is suffering, for example, for with cancer or HIV, where the social support is required. And then it can be healthcare provider related, when the proper instructions are not being given to the patient. As a result of it, they will not be able to comply with the medication. Abuse of recreational drugs, use of psychoactive active drugs to induce the altered state of consciousness is another challenge that we are facing. And then the last three challenges, these are sort of interconnected, where the medicines are supplied through unregistered online pharmacies, online advertisement of prescription drugs, and distribution of substandard and spurious, falsified or counterfeit medicines. So all the last three problems can easily be addressed by the proper implementation of rules and regulations set by the national regulatory authorities. So these are few major challenges that we are facing. And in the next slide, I'll share with you how the pharmacists can contribute in addressing these problems. Starting first with health literacy, educating the patient, counseling the patient, promoting health among the patient is always beneficial. Management of acute and chronic diseases, especially I put more emphasis on chronic diseases, because we have some common risk factors and preventable risk factors. For example, obesity and smoking, a few of them. So here the pharmacist role is really essential. Next is environmental care. So proper medication disposal is another responsibility where pharmacists play an important role. Then we have e-health. E-health, the term may seems fascinating, but this was first introduced in 1999, and then it has a very broad base. So the meaning varies from country to country, and then from time to time as well. E-health, at time it was considered for e-prescription, telemedicine, tele-rehabilitation services, and clinician decision support system. So e-health is another way forward where few of the challenges can be addressed. Next is patient counseling and patient education. It is quite straightforward. Following this is pharmacovigilance, that is science and activities related to detection, assessment, understanding, and prevention of adverse effect and drug-related problems. Here, the pharmacist can play a role either involving in spontaneous reporting or active reporting. And then lastly, we have pharmacist-led interventions in vulnerable populations. So in the vulnerable populations, you may include, for example, patients who have a compromised immune system, patients with the extremes of age, geriatrics, pediatrics, lactating mothers, pregnant women. So there also the pharmacists need to take the initiative to ensure the rational use of medicine among these populations. Moving further, let me share a few of the common roles of the pharmacist. So the roles can be divided into two: product related and patient centered. The product related roles more or less across the globe are common. For instance, drug discovery, medication dispensing, community pharmacy. And then in certain countries the pharmaceutical care component is missing. The reason behind is, I think, the emphasis on various courses in the curriculum. So in the developing countries, the pharmaceutical care process is missing, where the pharmacist is not actively involved in the patient care process. And then, as I said earlier, The reason behind is the structure of a curriculum is such that more emphasis is given on product related courses than the patient related or patient centered services related courses. So as a result of it, it's a sort of double whammy, because now if the pharmacist is not trained for the pharmaceutical care during their professional program, for sure they will not be able to contribute as effective healthcare team member when they join the healthcare professional team. And lastly, we have public health promotion, promoting healthy lifestyle, improving nutrition habits, managing health education programs, enhancing the quality of life of the population. So these are various roles, as I said earlier, can be divided into product related and patient centered. Patient centered roles are missing in developing countries because of various reasons. So there is a great need of the time now to involve the pharmacist in patient care process. So let's have a look what is the patient care process. But before that, we need to know what are the reasons of changes of pharmacist role. Advancement in technology. So in the advancement, various automations have been carried out in the pharmacy. And because of artificial intelligence, machine learning, deep learning, these technologies later in future are going to be used, and some are still in use in developed countries, to generate patient-centered or patient-specific algorithms, and maybe in precision medicine as well. Changes in the healthcare module, emphasis on the patient care. These are the few reasons of why the pharmacist role have evolved and need to be evolved in certain countries. Pharmacist is a critical member of patients' integrated healthcare team, and we always take pride that we ranked among the top three most trusted profession according to Gallup's poll released in December 2023. So, pharmacists are one of the most reliable healthcare provider that is easily accessible and then can contribute to improve the clinical and humanistic outcomes for the patient. So, pharmacists partner with patients and other clinicians to improve medication therapy management, medication reconciliation, where the pharmacists compare the patient's medication order with all the drugs that patient have been taking, disease management and patient education. So today, their role is changing at avalanche pace and becoming more strategic. Let's have a look. What are the opportunities where the pharmacist can play more strategic role? Medication therapy management, where the pharmacist ensure the rational use of drug and try to achieve the maximum benefit by the proposed therapy and minimum harms involved because of the drug related problem to the patients. Medication reconciliation, medication care coordinators, disease management, follow up consultation after primary care visits and hospital discharge, because in community they are easily accessible. And then, as in the previous slide, I did mention that the trust is there among the patients. Patient engagement, patient behavior coaching, patient education and consultation. So all these roles the pharmacist can only actively involve if the pharmacists have certain type of skill sets required for these specific roles. And then these skill sets can only be inculcated in their personality once they have trained accordingly during their educational years. They can be active members of chronic disease management teams, creating local partnerships for adherence and monitoring programs. And this one in Malaysia has very good system called MTech, Medication Therapy Adherence Clinic, where the pharmacist is actively involved to ensure that the patient remain adherent to the treatment, and then pharmacists check the efficacy, safety of the prescribed regimen for that specific patient. So maybe 2 3 decades before, the pharmacist was not a part of healthcare team member, so pharmacists used to work in silo. But with the advent of with the passage of time, now they are the effective member of healthcare team. So previously they were more like outside the healthcare territory. So with the passage of time and with the evolution of their roles, now they are the active member of healthcare team that ensure optimized patient care. So what is the patient care? Patient care is becoming more integrated and coordinated effort focusing on value and quality of care rather than on volume of services provided. So it's a sort of teamwork between doctor, pharmacist, nurse, dietitian, and even to the community pharmacist. To fulfill the pharmaceutical care responsibilities and attain the goals of the therapy, so pharmacists, we not only pharmacists, as a healthcare team, we have to ensure that therapy is appropriate, effective, safe, convenient, and cost effective as well. The pharmacist must use consistent, systematic, and comprehensive process of the patient care. So for this one, pharmacists need to have certain types of skills and knowledge background. Then only he or she can contribute to the optimal level of patient care. So these are few basic components for the knowledge and skills domain a pharmacist should have: knowledge of drug therapy, non-drug therapy, patient assessment skills, knowledge of laboratory and diagnostic testing, so that the patient can correlate these laboratory investigations with the monitoring of the effectiveness of the treatment. Communication skills, this is one of the fundamental skills, and then on the priority list it should be at number one, because pharmacists require two different types of communication skill set. One is just for healthcare providers, and then second one is specific to the patients. And then patient monitoring skills for certain drugs, monitoring parameters are very important to decide whether the patient should continue with the medication, or we need to adjust the dose of the medication, or even we need to change the medication accordingly. Drug information skills, therapeutic planning skills, and knowledge of the disease. So if the pharmacist is carrying this spectrum of knowledge and skills, for sure he is going to be an asset in the healthcare team. Otherwise, the pharmacist cannot contribute, and then the roles will remain traditional as ever before. So this is a patient care process that starts with gather patient information, assess information, develop patient care plan, implement care plan through intervention, and then do the follow-up. In the upcoming slides, we will see in detail what is the patient care process in Malaysia and why this process is so effective, and it can be considered as a gold standard for especially for the developing countries. All right, so moving further, pharmacists can also be engaged in public health programs, for instance, needle exchange program, disease screening, pregnancy testing and counseling, immunization. In certain countries, the pharmacists are the main player in immunization drive. Counseling for at-risk population. So at-risk population usually include the patients who are in the extreme of age groups, geriatrics, pediatrics, include even pregnant women, lactating mothers, patient with end organ disease, or even the patients having immunocompromised status. Then pharmacists contribute to smoking cessation program as well as family planning. So as I highlighted the importance of communication skills for the pharmacist at two different tiers to the healthcare providers as well as to the patient. So in order to be having good communication skills, you need to know what are the barriers of communications. These barriers can be from the healthcare provider origin, or it may be the patient related. So there are certain common barriers, for example, internal factors, previous experience, attitudes and values, culture, heritage, religious belief, self concept, language barrier, use of jargons, non-verbal expressions, environmental factors. So once the pharmacists have an idea of what are possible barriers and address these barriers in start, then only the communication can be carried out effectively, and then the patient can get the full benefit from the pieces of advice given by the pharmacist. All right, the next one is documentation. A valuable communication tool for further encounters with that patient and with other healthcare providers. So there are several different methods that are used for the document patient care. And nowadays, in advanced countries, in developed countries, it is strongly recommended, and they have a computer software options. And then by the use of these different softwares, for example profdoc and all that, there is a sort of automation, and then it helps to keep track the patient record for a longer period of time, decrease the search time, and then to have a better communication even among the healthcare providers. Then contents of medication record, so it includes admitting data, consent form from the patient, and then the guardians, physician orders, flow sheets and graphics charts, progress notes, laboratory data, diagnostic procedures, consults, operating room reports, admission history, and medication administration record, and miscellaneous. So the contents of medication record may vary from patient to patient and from setting to setting. So most of the time, more or less, the contents remain the same. Previously, in the traditional model, if you see, each healthcare provider was working in silo. There is no sort of communication between the doctor, between the pharmacist, and then other healthcare team members. So this is the traditional model where there is no collaboration, there is no integration, there is no coordination. And let's have a look the new model: collaboration, integration, and improved outcome, where primary care physician develops a patient care plan with the patient. Coordinated care team provide efficient patient-centered care. New models are emerging in the form of consolidated and collaborative network. The beauty of this system is it inculcates a sense of accountability, and then by the end of this, by implementing such system, the patient care process can be optimized further. Let's have a look on medication therapy management services. It's a comprehensive assessment of patient drug related needs. So an individualized care plan is set with the desired goal of the therapy with the patient, and then the reason behind why we need to involve the patient in clinical decision making in medication therapy management service to ensure the compliance. And then if we listen the patient, what might be the hurdles that the patient may experience in future. So these hurdles or these barriers can be addressed proactively, and then the patient care process can be optimized. Appropriate follow-up to evaluate patient outcomes that results from the care plan. And then in medication therapy management service, sometime abbreviated as MTM also, each medication is appropriate for the medical condition. Medication is being effective and achieving the goals established earlier. Medication is safe for the patient, and the patient is able and willing to take the medication as intended. So in MTM, once the patient is involved in the decision making process, we strongly believe that the compliance rate for such patients are much higher in comparison to those who are not involved in clinical decision making process. So these are the core elements of medication therapy management, can be categorized into two phases: medication therapy review, intervention, and or referral. So in the medication therapy review, patient is interviewed, database of the patient information is created, and then the review of medication for indication, cost effectiveness, safety, adherence will be considered, and then list the medication related problems and prioritize the problem and create a plan. So I always recommend to my students in clinical pharmacy to follow Pharmaceutical Care Network Europe classification of drug related problem. It is a very comprehensive tool that allow the students and even the pharmacists working to identify the drug related problems and then prioritize which problem should be addressed first and which problem are the causes of the problem can be considered for a longer for a later part of the plan. And then once the plan is set, then the intervention is given to the patient, and then it can be after the intervention is given and then the plan is implemented, the desired goal have been monitored closely, and based on the implementation plan, it will help to create or communicate through personal medication record, medication related plan, and documentation and follow up. These are a few core elements of medication therapy management. In Malaysian context, is slightly different that I'm going to share with you all in upcoming slides. All right, so MTM service model in pharmacy practice includes 5 core elements: MTR, medication therapy review, personal medication record, medication related action plan, intervention or referral, documentation, and follow up. So for each domain, there are a certain set of actions pharmacists need to take. What is MTR? Is a systematic process of collecting patient specific information including patient demographic data, patient medical data, medication therapy the patient is taking, try to identify medication related problems, as I said, using PCND classification of drug related problems, develop a prioritized list of medication related problems, and create a plan to resolve them accordingly. Personal medication record is a comprehensive record of patient medication, prescription and non-prescription medication, herbal products, and other dietary supplements. Medication related action plan is a patient-centric document containing list of action for patient to use in tracking progress for self-management. This one, MAP it plays an important role for chronic diseases, because in certain chronic diseases the patient self-management plays an important role. I'll take the example of patients who are having asthma. So if the patient know how to use asthma action plan and what the patient should do if the patient is suspecting to have asthma exacerbation, so all these will be a part of medication related action plan. Then we have e-health, e-pharmacy. It's a fascinating world where we have the electronic patient records, electronic dispensing, including decision support in handling alerts, electronic communication with healthcare provider. In certain countries, it is really well established. Certain countries are on the path of developing it, and certain doing sort of pilot testing to make sure that it should ensure the better outcomes at the end of the day. So e-health, e-pharmacy, as I said, it has a very broad foundation. It may include telehealth, it may have m-health, it may have e-dispensing services, e-pharmacy, e-prescribing services, e-health services as well. And then value of e-health and e-pharmacy is monitored. We call it ECHO model, economic, clinical, humanistic outcomes. So our goal is to reduce costs, to ensure it is more efficient and effective, improvement of clinical benefit, increase patient empowerment and satisfaction by enabling the patients to self-manage their conditions wherever appropriate. And then the list of services may vary from region to region. It may include e-prescribing, and with the use of e-prescribing, the prescription related errors have been reduced significantly. Adherence services where the patient can have they may use a sort of reminding system, services for new medication, locating a pharmacy, checking stock. This is for the pharmacists in the hospital and even in the pharmacy. Online consultation, ordering and OTC online, monitoring, reminders, management, clinical information between the healthcare providers. In few countries, pharmacists are actively involved in the immunization drive, so they play an important role in prevention by advocating and administering immunization. But for this program, for the safety of the patient as well as the pharmacist, the the pharmacist should be properly immunized. A vaccine administration program requires a solid infrastructure for appropriate training staff and physical space and written policies and procedures about storage, handling, patient screening, and education. And this one in the immunization program, especially during COVID-19, pharmacists were among the main players when it comes to carry out the vaccination drive against COVID-19 in most of the countries. So storage and disposal of injection supplies, disposal of and prevention of exposure of biological hazards. And as I said, pharmacists should be fully immunized to protect their health and the health of their patients. All right, so all these roles were more practice based till this slide. So now we will see the role of pharmacists in clinical trial. Pharmacists can be a valuable member when it comes to a clinical trial team. They can work in range of other roles. It's in phase one trial units as a trial coordinator in pharmaceutical industry. Pharmacists entering clinical research could start in any one of these areas, developing a role in that area and then move into another area as well. They can help to review the trial protocol, reviewing packaging and storage arrangements, advising patient on correct use of drug being studied, ensuring clinical trial is managed in accordance with legislation, research ethics committee, including human ethics for the clinical trials and even for the other preclinical studies for the animal ethics, assessing study design and methodology, choice of study drug, comparator, blinding, formulation, and administration related issues. The pharmacist can play a vital role. WHO and joint FIP come up with the guideline of good pharmacy practice. So they set four role for the pharmacists. Role one is prepare, obtain, store, secure, distribute, administer, dispense, and dispose of medical products. Provide effective medication therapy management. Role two is critically missing especially in the developing countries. Role three, maintain and improve professional performance. And lastly, contribute to improve effectiveness of healthcare system and public health. Role two and role four. These are the missing components for developing countries where the healthcare system is overly stretched, and unfortunately because of inadequate training of the pharmacy graduates, they are not fully utilized to provide these services. All right, so let's have a look how the pharmacy services in Malaysia evolve, and how pharmacists are contributing to ensure better patient care in Malaysian setting. So the pharmacists are involved in ward rounds, and then activities include patient assessment, pharmaceutical care plan, bedside counseling, and identify drug-related problems. Although they are not using pharmaceutical care network classification of drug-related problem, in Malaysia they have their own set of parameters that they consider for the identification and resolution of drug related problems. So they use certain types of clinical pharmacy forms abbreviated as CP forms. So have CP1 form that is used for medication history assessment form, then CP2 form that is pharmacotherapy review form, CP3 is clinical pharmacy report form, CP4 is referral form, and then this is very unique to Malaysian healthcare setting, where they have medication therapy adherence clinic, commonly known as MTAC, and this clinic is directly under the supervision of pharmacists, and then the primary objective is to optimize drug therapy, to improve medication adherence, to reduce or prevent the occurrence of adverse events and complications due to drug regimen. And believe me, this clinic really helping the patients not only to achieve the clinical outcomes but other humanistic and economic outcomes as well. Few studies have been conducted to check the impact of MTech clinic on psychosocial well-being of the patients, and it has found that the patients who utilize these services, they have better psychosocial well-being in comparison of psychosocial health in comparison to those who are just relying on the traditional model. So in total, there are 13 medication therapy adherence clinic, and mostly all these clinic focus more on the chronic management of various diseases, including diabetes, specific clinic for warfarin, then RVD, respiratory, nephrology, geriatric, psoriasis, hemophilia, rheumatology, psychiatry, and stroke. And all these clinic, the pharmacist is the person in charge, and to make sure the pharmacist can provide the contribution to the best of his or her abilities, they come up with a proper system that is governed by a protocol that we will see maybe in the upcoming slide. Other than that, pharmacists can be involved in home medication review. This can be done by the multidisciplinary team of healthcare professionals. So it may include psychiatric HMR, neurology, stroke HMR, and geriatric HMR. Then harm reduction program or methadone dispensing program to support the success of MOH methadone maintenance therapy via directly observed therapy, develop strong pharmacist-patient relationship, collaborate with physician and promote other healthcare providers to create seamless care and to achieve better retention rate. So what's being done in harm reduction program? Patient verification and assessment is carried out, dose is prepared, and then directly observe therapy. Drug surveillance. So in certain hospital in Malaysian healthcare setting, they have very well established antimicrobial stewardship program. Referring to the healthcare challenges, at the second in our list was resistance to the existing drugs, and then the most important one was antimicrobial resistance. So for that, in Malaysia, they have antimicrobial stewardship program, and it is well established program, And then with the help of this, the rational use of antimicrobial is ensured. Other than that, surgical prophylaxis audits are being carried out. Antibiotic point prevalence surveys have been carried out as well. Then they have quality initiatives. Pharmacists as a part of the team in Hospital Clinical Research Center as preceptor for provisionally registered pharmacist research project, involvement in the clinical trial and involvement in quality assurance studies have been carried out in Malaysian setting quite frequently. So as a result of it, it strengthened the services through the establishment of clinical working committees, international partnerships, development of training module and teaching material, establishing training centers, and appointment of dedicated preceptors. And then all the practices are standardized with the help of guidelines and protocols, and quality assurance audits at clinical and pharmacy practice settings are carried out accordingly. So these are few examples of protocols of MTech clinic. These are freely available. Those who are interested to explore further, and then if there is anyone from the policymaker, I think it's a very good initiative, and it's very unique to Malaysian healthcare setting where the pharmacist is in charge of this MTech clinic, and then ensuring that the pharmacist can contribute for the betterment of patient care. So these are protocols of MTech clinic for example, for MTech diabetics, diabetes, MTech respiratory, MTech warfarin. And then the career pathways for the pharmacists, they can be in pharmacy practice and management, clinical pharmacy. Research is one of the component where there is quite a sort of unsaturation. Still, there is a lot to work on. Regulatory pharmacy to ensure that the drugs are being used in line with rules and regulations set by the regulatory authority, and then pharmacy enforcement. Previously, a pharmacist was considered a sort of not having the specific specialities, but now with the Board of Pharmacy specialty specifically introduced by American College of Clinical Pharmacy, they have the expertise focusing on pharmacotherapy, ambulatory care, nuclear pharmacy, oncology pharmacy, psychiatry pharmacy, and emergency medicine. And then for the antibiotic stewardship program, development of ASP protocol for the pharmacy. So if you see, the journey was started for the pharmacist as a generalist, but now it's more into specialists. So and specialists in infectious diseases, nephrology, cardiology, oncology, and critical care pharmacy. So this brings me to the conclusion of our today's webinar. To succeed in a value-based healthcare system, pharmacists need to define what they offer to contribute improve health outcome, determine what proactive steps to take achieve these ends, and now is the window of opportunity for pharmacists to carve a broader position in changing healthcare landscape as it evolves to meet the goals of optimal healthcare. And I repeat again, for the developing countries, emphasis should be given at the grassroots level during their professional training. Then only we can get the crop at the end of it with the desired skills, desired knowledge, and then to ensure the optimal health care. Without this, it will keep on in a sort of vicious cycle, and for the developing countries, we will not able to engage pharmacists proactively in the healthcare process. All right, so with that, there is a message at the end. If you want something in your life you have never had, you will have to do something you never have done, by J.D. Honson. And these are the references that I have used for today's webinar. Thank you very much. Lastly, dare to dream, be better, explore more, and be more. Thank you very much.
All right. Okay. Thank you so much, Dr. Sohail. I really like the slide be more touch at the end. It's a bit fitting, I think. Okay, so anyway, Dr. Sohail, thank you so much. And yeah, so if you have any questions to the viewers, if you have any questions at all, you can just leave them out in the comment section. But Dr. Sohail, I really liked your presentation and you touched on a lot of things. But I think in general, the Malaysian population don't really understand what are the roles of pharmacists because they think pharmacists just stay behind the counter and just give them the medicine. They don't really understand that there are so many other things that pharmacists do. And so, can you just shed a light a bit on what kind of specific role do pharmacists actually play in the hospital?
All right. So actually, if if I answer your question based on my experience here in Malaysian healthcare setting, while
Mm,
I have been actively engaged in conducting healthcare services related research here in Malaysia, I have found that your claim is true maybe for general public.
yeah,
All right.
yeah.
But for the patient with the specific conditions, for example, if someone is having asthma, someone is recovering from stroke, if you ask from them what is MTech clinic and how pharmacist is offering the services and whether that was effective or not, they will give you very specific answer. And then you will be surprised to know how well they know the role of pharmacist.
Mm-hmm.
Referring to general public, yes, there is a need to improve awareness for the general public, and then this can be only improved by the pharmacists themselves. If you think, if you consider, it's in your responsibility to ensure because you take the ownership of your patients. If you just want to stay behind the counter, so it's a sort of personal thing. But in Malaysian setting, what I have noticed that the beauty of the healthcare system is it's not only pharmacists, even the other healthcare team members, they take the ownership of the patients, and this is really good thing that we need to inculcate even for the other countries as well. And as you highlighted, yes, there is a need to engage general public. Therefore, various type of health campaigns are being conducted by various institutes just to promote health and to help those who are in need. And by such initiatives like conducting home medication reviews, by conducting health campaigns periodically, maybe on the specific day of certain diseases, I think we can further improve the awareness in the general public. But for the patient, specific to the patients, those who are using the public health care services, the public hospitals, they are quite well versed with the role of pharmacists.
All right. Okay. Yes. Thank you, Dr. Sohail. So, what do you think about what we're doing with our program in actually making sure that these pharmacists will go out and they will be able to contribute straight away into the healthcare industry? What do you think
Yes.
about our efforts?
In my whole presentation, I keep on highlighting the importance of the training we are giving to the students, because in future they are going to be our reflection, they are going to be our project, and in a way we have this responsibility to ensure them that they are well trained, and then they have highest level of ethics and professionalism once they go in the practice. So how we are ensuring that, we have various mechanisms by which we ensure the students will do the students evaluation while in the hospital or industry or during the community pharmacy attachment. So we are not just focusing on their cognitive skills or psychomotor skills, we are even emphasizing the importance of ethics, importance of professionalism, importance of empathy. That's the most important thing for me. And that's lacking also. We need to work on this further, because there is no end to it. It's you keep on improving, and at every passing day you engage your students better to 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 ensure that they carry these core values of the pharmacy profession when they go for the practice. So the curriculum is designed in a way, and then the assessments are in place so that we not only focus more like how well they are memorizing certain things, how well they can perform in a sort of controlled environment, but we do the evaluation even in real life situations. And then to your to our audience, we involve the hospital preceptors, we involve the community pharmacists, we involve the industrial people to evaluate our students, and then based on that we used to give the feedback to the students just to ensure that once they go to their professional life, so that we can take proud of our products, because these are our products, these are our
Right.
future. The profession belongs to them.
Hmm. Yeah, I think I get where you're coming from, because even though I'm a non-pharmacist, I still take pride in knowing that I'm trying to educate the future pharmacists, and it would really make me proud that if our students can go in and straight away contribute to the healthcare system. So I know that I've actually played a part in making sure that the healthcare system in Malaysia keeps on running. So yes, I get what you mean. So we are actually
Yes.
we're nearly an hour into the webinar, but we can entertain a few questions, I think. So the first question that I have comes from Facebook. This person is saying that he came in late, but this person has a question. So I think his question is basically, what are the differences between nutritional health and the effectiveness of the drugs as
Come
compared to the
again.
nutrition supplement?
What are the difference? I
Okay, wait. I will try to show you the question if you can see that. Yep. So this is the question that was posed by AMJD.
All
So
right.
yep.
So nutritional health is okay. As I said, there are two common preventable risk factors by which we can avoid delay the progression of certain chronic diseases. One of them is smoking cessation, and second one is obesity. Nutritional health can help as a sort of non-pharmacological intervention to promote the health in general. But once we are talking about drug, it is very specific. It is very specific for specific indication for specific patient with the specific condition. We have the first line option, we have second line, and then based on the adverse effect profile, based on our desired outcome, we decide which specific drug should be given. And for each drug, it comes with the desired effect, and it comes with the side effect as well. So being the pharmacist, our role is to ensure that the patient gets maximum benefits with the treatment and minimum harm. Here comes
Hmm.
the role of patient education and patient counseling. But nutrition health also plays an important role. I'll give you one example. For example, if a patient is having hypertension, and the patient is categorized as pre-hypertensive, although in the new classification they are no more using this term. So at that specific phase, once the patient is clinically declared as hypertensive, the patient can be suggested for non-pharmacological interventions. For instance, increasing physical activity. For instance, DASH eating plan. So this is nutritional health. DASH stands for dietary approaches to stop hypertension. So in that specific context, yes, the dietitians have a role to play. But once the patient is clinically diagnosed, then it will be a sort of add-on approach. We need to go for the drug therapy. So the nutritional aid can help to improve the outcomes further, but the patient cannot rely completely just on nutrition alone. So I think we really need to differentiate, because the nutrition has its own limitation. It can accelerate the process to achieve the desired outcome, but it cannot meet the desired outcome on its own.
Hmm.
So once someone is being clinically diagnosed with any clinical condition, then yes, non-pharmacological interventions are suggested, but pharmacological interventions are our mainstay. So I think it has a sort of add-on role to accelerate further. to exaggerate towards achieving the desired outcomes, but alone relying on the nutritional health for a clinical condition is not going to be helpful.
All right. Okay. Thank you, Dr. Sohail. Okay. So we have 5 more minutes before we make this an hour long webinar. I would like to entertain one more question. So this is actually being asked by, I think, one of our colleagues, actually. Yes. So, Dr. Sohail, do you like to comment on the roles of pharmacists in Malaysia compared to other countries?
All right. So again, the role of pharmacist, it depends in which context you are asking this. If you are asking in the clinical pharmacy or pharmacy practice, it quite advanced. Is doing it. The pharmacists, they are there to cater the needs of the patient at the community level, at the hospital, in the hospital and the clinical setting as well. The reason behind the curriculum is structured in a way so that the emphasis is more on the emerging roles than the traditional roles. So, what are those traditional roles? For example, drug discovery, dispensing, and all those, these are considered as traditional roles. So, in Malaysia, emphasis is there for traditional roles as well, but more emphasis is given for the patient care or the service oriented or patient centered roles. So in context, in developing countries, still they are completely relying on traditional roles. For example, a lot of pharmacy graduates used to go to pharmaceutical industry and then they get the training in that specific domain in the industry, but they are not just like directly influencing the betterment of healthcare system. So this is here in especially the countries like Malaysia, Australia, New Zealand, UK, and US. They are doing really good job when it comes to the patient care. But in the developing countries, still they are emphasizing more on the traditional roles. I think this is the right time to involve them in the healthcare process to enhance the patient care. Only then they, in the developing countries, the healthcare system is already overly stretched. So the pharmacist is a workforce that is underutilized, and it's the right time to consider that.
All right. Okay. Thank you, Dr. Sohail. I think to just add on to that, I just think that I think as the years have progressed here in Malaysia, I feel that the pharmacist role have definitely evolved, and we're not really as traditional as we used to be. And I think we see more and more pharmacists now in research. More and more pharmacists now are taking a more active role in public policy, for example. And I think this is especially needed.
Exactly. And sorry, I forgot the research component. In research, they are actively involved. Even in the curriculum, they have to spend minimum 1 year just to conduct clinical research or practice related research. And then based on their findings, it helps to improve the system further.
Yeah, I think to just add on your point, I'm not quite sure, but like in Malaysia, for example, what kind of research field do you think the pharmacists can actually play a really big role in besides just doing clinical pharmacy?
All right. So pharmacists can be actively involved in health promotion related research. All right, psychosocial well-being of the general public. We really have to, because that when we use the term clinical means you are dealing with patient directly. We are not involving general public at all. But with the passage of time, I have seen that there is a shift, and then it's in balance now. People, the pharmacists are conducting research in general public to promote health, as well as conducting research in patients to achieve the desired clinical outcomes. So it's a sort of like conducting research in both specific domains, one in the clinical or hospital setting for the patients, and in the general public to promote health, to identify the problem first, for example stress, for example prevalence of various psychological conditions, and then how to address those specific conditions. And so it's a sort of balance nowadays for the clinical as well as research in the general public.
All right. So, do you think that, for example, in our university, do you think that we are we are providing the infrastructure for pharmacists to join our university and be able to contribute in all these multiple ways?
All right, if you're talking about undergraduate students, my answer is yes, because in our final year research project, we have multiple screening mechanism where the students really have to defend themselves, and then before the students start their study, we have a screening mechanism to ensure that this study is ethically sound, methodologically sound, and then at the end of this study, there should be some contribution in the science. It's not like a sort of theoretical study, and then at the end of it, the patient students printed thesis lies in the library. So this is not what we require. So we have the even in the evaluation, first we have a proposal presentation stage, and then at the end of it we have the final year presentation where the students share what they have learned and what is the outcome of their study.
All right. Okay. Thank you so much, Dr. Sohail. I think that is all that I have to ask as well. And so, thank you so much. And yeah, thank you so much. And yes, so for our viewers out there, if you would like, if you do have questions about pharmacy, or if you have questions about the faculty, if you have questions about the university, you can just contact us on our Facebook page, and you can also contact the MAHSA Facebook page, or you can contact the faculty's Facebook page. So thank you so much, everyone, and thank you, Dr. Sohail.